Hi, are you interested in getting into nursing but a bit daunted by having to take out a student loan to pay for it? In this video, I'm going to talk about how you can earn whilst you learn in training to be a nurse. Hi guys, my name is Sabrina Phillips and I am currently an interim director working with the NHS and partners. In this, on my channel, I talk about, give you the nursing tips to skyrocket your career. I'll give you some simple lock hairstyles so that you can rock a boardroom like a boss, and when we can travel I'll give you some simple budget tips so that your money can go even further. Well, without further ado, let's get back into this video. So this is part 2 of a mini series of 3. So if you would like to get into nursing in the traditional route, I've already done a previous video, so please do have a look. But in this video, as I said, I'm going to tell you how you can earn whilst you learn and become a nurse. So for those of you who are wondering what that is, basically these words change your life. So it's called nursing apprenticeship degree. Become a nurse apprentice and learn how to become a nurse, but you get paid for it. So nurse apprentice will start at a band 3, and understand the range for band 3 starts at £19,737 to £21,142 per year. In terms of the length of time for the nurse apprentice, it is 4 years. However, if you have previous qualifications or a degree, you can potentially get accreditation of prior learning, experiential learning, which could reduce the time of your nurse apprenticeship by about 2 years. If you're wondering, how do I get into this? So there's 2 ways into it. So one, you can either apply directly to an NHS organisation that's offering this as nurse jobs. However, if you are currently working with an NHS trust, what I would suggest is you speak to your line manager or your education and training department and find out if they are offering this nurse apprenticeship degree. In terms of the qualifications that you'd need to do that, to be able to get onto the course, so you either need to be an employee of the organisation or have applied specifically for this job role. Yep, so that's a 2-way in into a level 5, or like for some people they'd have done a nursing associate or assistant practitioner role, and I'll be talking about what that is in part 3. You need to have a total of 96 UCAS points, whether that's via A levels, GCSEs, BTEC. What I would suggest is you speak to the organisation that you're applying to. So if you're already in an NHS trust, find out from them what qualifications you would need or the equivalent that would help you to get that. The trust that you apply to, because they'll make it really clear in their advert what you would need to be able to apply for it and meet the university criteria. Is you need to have math and English, or what they call functional skills. So some people might have come out of school a long time ago and cannot find their certificates. So there are assessments that you can do to determine what your functional skills or levels are in math and English, or if you've done the assessment and you're not up to that level, your organisations also offer extra support in terms of getting you to that level so that you can do the course. So that's how you get in, and that's the qualification. So what does the course entail? So you will be studying the same nursing program as nurses doing the 3-year degree program. The only difference is that you take a bit longer. The other thing, as I said, you'll be earning while you learn. So you'll have a base ward or team that you'll be based in, where you'll be doing your practice learning. You will also be expected to attend university at least 1 day per week. So 20% of your time needs to be spent in university, and that is non-negotiable. So when you've got university days, you should be at uni. You can't be taking annual leave. So you've got your base ward, you need to be in uni at least one day a week. Plus also over the course of the 4 years, you will be in different clinical placements, where you would learn about the different areas of nursing so that you will build your skills. But as I said, you'll be working on a base ward where you'll be able to put that into practice. At the end of your apprenticeship, you will be expected, once you've finished the academic as well as the practical skills, and they are 50-50, so 50% of your work will be academic, 50% will be practice, but you'll be expected to also do an endpoint assessment, which would then confirm that you have met the standards of the NMC to be registered on the register as a registered nurse, and you will get a degree in nursing after the 4 years. The difference is, as I said, you will be earning whilst you learn, so you wouldn't have to take out a student loan and so you wouldn't have to pay that back once you start working. And also, because you're earning whilst you're learning, you don't need to think about taking out funding to help with your day-to-day life, because, as I said, you'll be paid as a band 3 throughout the time that you're on the course. So this is the second way that you can get into nursing. And the last bit is, you might be wondering who can apply. So again, because this is in reference to the UK, so it is open to UK citizens or people that have got leave to remain or indefinite leave to remain. Or understand, for those people that have got leave to remain, you need to ensure that for the entirety of your course, your leave to remain covers that period as well. So I hope you found some value and hope you found this helpful. Please do leave any comments or questions below, and let's be bold and brave together, and I'll see you in part 3 where I will talk a bit about how you might get into nursing via the nursing associate or assistant practitioner role. So see you on the next one, and take care. Bye.